Okay, I am Dr. Lance Vernon. Today we're going to do a demo on technique of brushing your teeth. So I have with me first a Typodont. This is obviously an artificial teeth. And I'm just going to be going over some of the concepts that we want to highlight, and then I will do an actual brushing with toothpaste in the mouth afterwards. So the main concepts with brushing are always use a soft brush. Why a soft brush? A medium brush, you will have a hard time doing the technique that I will describe. In general, you want to be touching all surfaces of all teeth when you brush your teeth. When? Usually at night is the best time. Twice a day is great, but at night is preferable. Why? Because your salivary flow goes down at night, so you want to disrupt the biofilm before you go to bed. So, the occlusal surface, the biting surface of the teeth, you'll want to get, and that everyone knows how to do, kind of a scrubbing motion that gets those areas clean. So I've done that, okay? This is just the conceptual level. Now, the main thing people don't do when they brush is to get, in essence, a 45-degree angle where the tooth meets the gum. So it's not straight on. Typically people do this where they're brushing straight against the teeth, and that's okay, but you'll get more effective plaque removal by angling the toothbrush at a 45-degree angle. So not 90, not 45-degree angle. So you're actually thinking about, okay, I'm getting the back, I'm getting the middle, I'm getting the front of each tooth as I go around. So as you go around, that angle of the brush is changing, so you're always hitting 90 degrees to the angle straight against the teeth, but you're also hitting a 45-degree angle relative to the toothbrush overlapping the gum tissue and also brushing against the teeth. So really the action is, and where plaque builds up is, where the tooth meets the gum. So as you go around, you're getting that 45-degree angle, you're getting that 45-degree angle, and you're probably changing your hand position here in some ways, but you're thinking about getting every surface of every tooth, and you're changing, and when you're on the bottom teeth, you're having a 45-degree angle down in towards the tooth and the gum, and when you're brushing your teeth, your upstairs teeth, your maxillary teeth, you're getting the 45-degree angle aiming up to where the tooth meets the gum. And again, front, middle, and side, where the tooth meets the gum, all the way around. Okay. Now when you get to the front teeth, you can get a lot of plaque and hardened plaque, which is calculus, behind these lower teeth. So the way to get rid of that, because it's hard to get this 45-degree angle behind those teeth, is that you push the toothbrush against the teeth and pull forward, aiming out. Okay? And that motion really cleans the lingual, the back side, the tongue side of those teeth. And same thing up top. You're pushing the toothbrush against the back of the teeth and pulling it forward. Now, if I had a mirror in front of me, I'd be getting stuff all over the mirror. We don't right now. We're not using toothpaste, but you get the idea. Now, what we haven't done so far is the lingual, the side of the teeth closest to the tongue. We haven't gotten that yet. And so we want to catch a 45-degree angle. It's really hard to do a 45-degree angle like this. I'm kind of probably coming in more diagonal. So the head of the toothbrush is aiming down, but I'm getting that 45-degree angle, and I'm touching all surfaces of those teeth. So you see that here, where I'm getting the lingual, the tongue side of the teeth, and I have a 45-degree angle, but I'm kind of cheating because I'm not really cheating, but I have this 45-degree angle, and the head of the toothbrush is diagonal. Okay. So at that point, I've really covered all of the teeth. I may not have gotten behind the back tooth, and sometimes you have to either open your jaw or close it in order to get that toothbrush way back there to get the backside of the backmost tooth, known as the distal in dentistry, the distal of the distalmost tooth. Distalmost tooth. Okay, so that is toothbrushing. Some people may have their lips maybe kind of tense when they brush, and they may actually need to use the other finger to pull their lips down. And you'll notice plaque is built up on specific teeth like the canine. So they actually pull their lip down in the mirror and brush those teeth, getting again that 45-degree angle. So the main thing people are not doing is getting that 45-degree angle on the cheek side of the teeth and on the tongue side of the teeth. And if you use a medium brush, this will hurt your gums. That's why you should use a soft brush, and use the medium brush on your shoes, okay? No medium brush. So this is kind of a demo outside the you know, without using toothpaste and a mirror. We'll do that next. And now we're going to transition over to talking about flossing. Okay? Okay, so we've had a question from the audience about force, the force that you use to brush the teeth. Usually this is more of an issue if you use a medium brush. You can get, the gums can recede around where the tooth meets the gum. You can actually get some wear in the, along the cervical of the teeth where the tooth meets the gum. And so force is somewhat of an issue. I think that the bristles should be bending a little bit. You shouldn't be pushing down like, and the bristles are really bent a lot. So you could probably err to the side of brushing lightly but effectively. In other words, being sure that you feel your toothbrush touching all surfaces of the teeth, especially in between the teeth. So this area here, where one tooth comes in and where the two teeth meet, I think you get that. So the other thing is some people brush kind of like this, and that can lead to maybe brushing too aggressively and being bad for the gums. So the standard speak is little circles, that you're kind of doing little circles. You're putting some force, not too much. If it hurts your gums, it's probably too hard. You can probably back off in terms of the force. So, have I answered the question? Okay. Maybe we'll take a break at that point.